And let's talk health now. Advocates in cancer care have asked the federal government to create a comprehensive center for patients. They say this will serve as one-stop shop for all cancer care needs for treatment and recovery. Kemi Balogun reports.
This year's theme is United by Unique, which emphasizes a people-centered approach to cancer care by placing individuals and their stories at the heart of the conversation. Gloria was diagnosed with cancer in 2010. She entered into remission but relapsed in 2018. She is now cancer-free and became an advocate in 2017 to bring hope and support to many women like her who are going through or have gone through the harrowing challenges that follow a cancer diagnosis.
I had a very strong family support. I wasn't married then, but my family was there for me. When I was diagnosed, I refused to live in denial. I only sought for second opinion, and when it was confirmed, I was like, okay, God, you have decided that this thing was going to happen. I am now here. I'm going to go through it, but come with me. And so I moved on. So each of my treatments went seamlessly.
Gloria says stigma still plays a key role in the cancer burden. And although there has been a lot of improvement in the cancer response in Nigeria, cancer patients still face several challenges.
As of 2017, when you go to the hospital and you cannot pay out of pocket, then you are done for. You just go home. But as we speak, the National Health Insurance Scheme has co-opted some parts of cancer treatments into as part of what they cover, into their coverage. So they cover surgery, they cover some drugs, they cover consultancy, they cover diagnostics, which is still huge. But there are some drugs they don't cover, especially some chemo drugs.
In Nigeria, there were over 127,000 new cancer cases and 79,000 deaths in 2022. Many cancer patients and, of course, survivors like Gloria may have felt the recent significant improvement in cancer care and treatment in Nigeria, but many of them still say that a lot more needs to be done in order to save more lives. Many initiatives have been put in motion by the government to tackle the cancer scourge inwardly. One out of this is the Cancer Health Fund. The CHF is an initiative of the Federal Ministry of Health and Social Welfare aimed at providing cancer treatment to indigent Nigerians and strengthening national cancer care.
We are currently working with the National Assembly people and the philanthropists that we have in the country to improve funding in this fund so that more cancers can be accommodated, and we are in a plan to expand it to virtually all the hospitals in the country, including the private facilities.
The good thing about the Cancer Health Fund is that it takes care of practically everything. There is no, as far as it has to do with cancer, and you are in the hospital where it is domiciled, you can access it free of charge. They can start off with 1 million, they can start off with 2 million, depending on the kind of treatments you're going through, and then you start accessing it. So it's a game changer.
This year, experts believe that while cancer affects millions globally, each person's experience is unique and personalized care is essential. Kemi Balogun, TVC News, Abuja.
The number of cancer deaths in the country seems to be on the increase, and we seek to know why. This is one of the many questions we'll be asking the Director General of the National Institute for Cancer Research and Treatment, Usman Aliyu, who is standing by to speak to us on Nigeria's plan to control cancer. But that will be after the break. Stay with us. All right, thanks for staying with us. Let's now speak more on today, which is the World Cancer Day, as we bring in the Director General of the National Institute for Cancer Research and Treatment, Usman Aliyu. He joins me on the news at 7. Thank you so much for your time, Mr. Usman Aliyu.
Thank you for having me.
So we understand that at the moment in Nigeria, cancer leads to over 72,000 deaths annually. That's about more than 30,000 for women and more than 40,000 for men. But we also understand that that number is set to increase. Why are we seeing the increase in number of cases as well as deaths?
All right, so thank you very much for that question. Just like what you have said, the incidence, prevalence, morbidity and mortality of cancer is on the high side, is on the increase. And just like what you have reported from the Globacan 2022, if you can see there, globally, there was an increase of cancer incidence to almost 20 million cases, and about 10 million plus death was also reported in the year 2022. There are so many factors that are implicated in the rising incidence and morbidity related to cancer. One, because of the aging population that we are having generally or globally in the world, the life expectancy of people is increasing. And the older you become, the more the risk of developing cancer because of the wear and tears. Now, westernization of the African subcontinent, imbibing the Western culture in terms of the way we eat, the way we socialize, taking a lot of smoking cigarette, drinking alcohol, taking a lot of fatty food, inactivities, that is lack of exercise. All these were related to increasing incidence of cancer. Also, industrialization and urbanization that is very prevalent with this century is also linked to rising incidence of cancer cases, generally globally in the world. Yeah, in the African subpopulation, what actually leads to increase death is actually denial. Virtually almost 80% of the cases in African sub-region present late, and that late presentation was because of denial. A lot of people doesn't want will say it's not my portion.
Mr. Lee, if I may quickly comment because of time, because you're making a very good point in terms of how people live in denial. But I also wanted to ask you that as a country, do we have a dedicated national plan for cancer control?
Yes, we have a 5-year strategic plan, which was developed by the National Institute for Cancer Research and Treatment, which is an agency established for cancer control under the Federal Ministry of Health. We have 2023 to 2027 National Strategic Cancer Plan. And this is the plan that currently the country is following to implement activities regarding cancer prevention, research, and treatment. So the Institute is holistically following the guidelines. We started in 2024, and if you can see, you can report, drastic improvement in cancer awareness campaign within the country, which we have been conducting starting from February in 2024. Establishment of screening centers that are currently ongoing to boost or improve early presentation and reduce the cases of late presentation in the country, which is cheaper than the treatment of cancer itself, is currently ongoing, and we are targeting the 6 geopolitical zones. So these are the applaudable things that within the span of 2024 the country is doing under the able leadership of His Excellency Bola Ahmed Tinubu and the stewardship of the Honorable Minister for Health and Social Welfare, Professor Alipate, and the State Minister, Dr. Isaac. Dr.
I wanted to sort of quickly
Sanako.
touch on this because it is quite important. The theme of the year is united by unique, and that highlights the value of individualized patient-centered care in the fight against cancer. And I was going to ask you what the plan is to ensure that this becomes our own approach as a country in terms of the treatment of cancer.
Okay, so our plan, you know, we've even before now we have started, you know, making a robust engagement with the centers of excellence that we have in the country of cancer. United by unique, what it's preaching is that there has to be a patient-centered approach to cancer care. Enough of the approach of one type of treatment fits all the patient. Every patient is unique in terms of the diagnosis of his cancer, the stories related to the emanation of that cancer. So therefore, the individuals and the specialists that are involved in the management of that patient has to come together and bring their uniqueness and approach the care in such a way that it is personalized. In the hospital, you know, currently we are advocating multidisciplinary team approach. And in that, through the genetic testing that we are currently doing, we should know the drivers of each and every cancer that an individual have. Because like the breast cancer, you assume sometimes no two breast cancers are the same. You have to do genetic testing to know the type of breast cancer that this one is having and tailor your treatment to that specificity that
absolutely
is,
and I like what you said earlier,
Mr.
Liu, which is stopping the one-size-fits-all kind of approach to treatment. And I'm hoping that those who are specialists in that area will follow that approach. Thank you so much for your time. Director General of the National Institute for Cancer Research and Treatment, Mr. Usman Aliyu.
Thank you very much for having me. Really.